Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, Ascension is now under investigation and scrutiny on a number of fronts. Ascension is, of course, one of the United States' leading nonprofit and Catholic health systems. They have over 134,000 associates, 35,000 affiliated providers, and 139 hospitals under its management in 18 states. In the Birmingham, Alabama area, this includes St. Vincent's and associated hospitals such as St. Vincent's East. Alright, a new news article has been published by WEVV-TV television channel 44 out of Evansville, Indiana, USA, dated January 18th, 2023. It reads here, local attorneys announced the filing of a lawsuit, that's a federal lawsuit, against Ascension St. Vincent Evansville on Wednesday that claims violations of the Emergency Medical Treatment and Active Labor Act, or EMTALA. That's EMTALA. This led to the death of an 8-year-old child. His name is Marco Gabriel. He died on September 22nd after his parents took him to the Ascension St. Vincent Urgent Care, Epworth Crossing. He was referred to the emergency department at the Ascension St. Vincent Evansville Hospital. According to the lawsuit, the nurse practitioner who examined Marco at the emergency department did not communicate with urgent care to determine the extent of Marco's evaluation. It also says that no interpreter was provided to communicate with Marco's parents, who primarily speak Spanish. The lawsuit goes on to state that no doctor ever saw Marco on that visit, and that St. Vincent incorrectly indicated several times in its records that Marco had no insurance and Marco's care was treated as self-pay. The lawsuit claims that the nurse practitioner assigned to Marco did not conduct any of the basic lab or blood tests and also failed to do the MRI recommended by the urgent care. It says that Marco was discharged to home and his parents were told to give him ibuprofen and Tylenol and to seek a pediatrician for further treatment. Marco was returned to the Ascension St. Vincent Emergency Department 2 days later by his parents with persistent symptoms of headache, fever, vomiting, and pain, with an additional symptom of confusion, the lawsuit says. It says that labs, an MRI, a CT scan, and a lumbar puncture revealed acute multifocal encephalitis, and that Marco was started on medications. After that, Marco was taken to Norton Children's Hospital in Louisville on September 21st. The lawsuit claims that treatment at Norton Children's Hospital was started too late to save Marco, and that he was pronounced dead on September 22nd. According to the lawsuit, the Ascension St. Vincent ER failed to provide Marco with an appropriate medical examination, including the MRI recommended by the St. Vincent Urgent Care. Quote, an appropriate medical screening examination that tested for the cause of Marco's severe headaches, fever, pain, and vomiting would have resulted in Marco getting immediate emergency care. Instead, unlike other children with the same symptoms, no such testing was done and Marco was sent home. I was a patient at Ascension's St. Vincent's East Emergency Department in 2018 and 19, and I was also self-pay. You can hear my own account in videos that are up there on that YouTube channel. My experience dealing with Ascension's emergency department in Alabama almost identical to this new account in 2023. Yeah, when you go into the ER, Ascension has a procedure that they follow, and apparently this extends to all their hospitals. What happened to me was I was taken to an examination room, and somebody entered and asked me a source of income, where I worked, or how I was going to pay for my medical treatment. And when I revealed that I was self-pay, I had no job and no source of income, the entire demeanor of the individuals involved in my visit changed. And I could notice body language and how I was being talked to. In my own case, I complained of neck pain and head pain. I thought I had broken bone in my neck. I was given several scans, x-ray, and CT in the Ascension emergency department. They came back and told me I had no injuries present, that I had just pulled a neck muscle. I knew that this was an error. I went and got those original images. I'll put them in this video. And as you can see for yourself, despite what I was told by nurses and doctors in St. Vincent's East in Birmingham, I had broken the underside of my skull. I almost died from the complications of this injury, but I survived. So what you can see here in this latest account is that Ascension is still dumping patients in hospitals. In this latest lawsuit, I urge you to go read the details of. It reveals something very key about the procedure that Ascension follows. Almost identical account to my own. There are others out there, I believe, who went to Ascension and their various emergency departments for treatment. They were told they had no injuries, or injuries to a lesser degree than what was the reality. And I believe there's conspiracy, negligence, and medical fraud actually occurring in these Ascension hospitals and among their doctors and nurses. They know exactly what they're doing, and they do it on purpose. Please go back and watch my videos and listen to my own experience dealing with the representatives of Ascension when I tried to get my own misdiagnosis corrected. And you can hear what they say. They would not do anything to help me.
Thank you for calling Ascension. At this time, our administrative office is closed and our associates are working from home to limit the spread of the coronavirus. To leave a message in the general delivery mailbox, please press 2. Thank you. You've reached the Ascension System office general mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impicciche, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, EMTALA. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital when I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impicciche, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.